Hi, I'm Dr. Roman Burk from Rocky Mountain Foot and Ankle, and this is our bunion video. I'm often asked, what is a bunion exactly and how does a person get one? Bunions are a deformity of the foot where the big toe starts to deviate from the rest of the foot and it angles towards the smaller toes. It's the most common form of deformity in a lot of adults, and it frequently can be painful. In some cases, the bunion is something that is the result of wearing incorrect shoes or having bad activities on your feet. In many cases, though, it's the result of our genetics. We look like our mom and dad here, we look like our mom and dad here, and we look like our mom and dad in our feet. So, a bunion frequently is evaluated or seen when a patient's big toe begins to cross over against their lesser toes. You can see in my skeletal model how the big toe starts to cross over top or perhaps underneath of the second toe. Bunions can range anywhere from mild to severe, where the toe joint actually starts to separate and sublux or dislocate. In this case, we've used an example of a mild bunion where the toe begins to deviate, and you can see how the second toe and the first toe are converging. That leaves a prominent bump right here, which can sometimes be painful or other times be completely symptom-free. In many cases, patients worry about whether or not a bunion is a major problem for them. Typically, problems with bunions are going to be associated with toes that cross over and create other problems, or if they get pain around the bump, or if they have balance or stability issues. And people often ask me, is there any way I could have treated this before coming to see you? Some very simple things that a person can do are to make sure that they have shoes that are wide enough and soft enough to accommodate their natural anatomy inside the shoe. If a shoe is too narrow, then the foot's going to feel a great deal of pressure and it's going to push on it quite hard. Or if the shoe is shallow and the toes cross over, it may be difficult to find a shoe that's going to match the toe box that those toes sit in. Technically speaking, there is nothing we can do about our genetics, but there are a lot of things we can do to accommodate or make our anatomy comfortable, and good shoes are one of the first steps. Additionally, people can do things like stretching the shoes or perhaps wearing pads or splints, which help to take away pressure directly on those bony prominences. Usually when a person gets to the point where they need to see a doctor, they want to know what's going to happen if they pursue surgery. When a person has a bunion fixed, they have to do more than just simply shave off the bump. The toe here and the bone behind it, also known as the metatarsal. These look like this in our bone model. The toe and the metatarsal need to be in alignment with each other instead of being out of joint. And so the results of surgery should help to realign the joint through both the toe and the metatarsal. If surgery is indicated, then a discussion with your doctor would talk about the different types of procedures that are possible based upon your specific problem. Thanks for watching. We hope you liked this video. If you did, please smash that big button at the bottom that says subscribe.